Well, this all started because I was tired of traveling, which is kind of interesting because all I want to do now is travel. But in 1993, I was working for a hospital corporation, and I was on the road all the time. I went from one hotel to another, from one airport to another, until one day I woke up in a room, a very generic looking hotel room, and I couldn't remember where I was or exactly what it was I was supposed to do that day. I actually had to find the phone book to remember what town I was in. So when I got home, I decided that I wanted to slow down a little bit. And there was an ad in the Tucson paper for the Director of Medical Assistance for Cochise County. So I called and I was interviewed and I was hired on the spot. So a few weeks later, I moved to Bisbee, Arizona. And I had been at the county health department just a couple of days when the school budgets were cut out in the Sulphur Springs Valley. And parents started calling the county health department requesting nursing services because the first thing that was eliminated from the schools were the school nurses. And that was the only health care that was available out in these little tiny villages: San Simon, Bowie, Dragoon, Pierce, Sunsite, San Azota, Elfrida, Double Adobe, many, many little settlements. So the director of the health department called me into her office and said, "Why don't you go out into the valley and see if you can find a grassroots movement for a community health center?" I said, "Sure. What's a community health center?" And that was in December of 1993. I asked people to come and participate in a planning board, and they did. It wasn't a smooth road. People in Elfrida make a profession out of fighting with each other, and they did that. I remember going to the rural health office at one point and talking to Jill DeSapien saying, "You know, these people can't agree on lunch. I really think a mission statement is out of the question." And she kind of patted me on my head and said, "Oh, Ginger, it's always like that. It'll be fine." And she was right. And over bratwurst and hot dogs, this disparate group of people came together and became a board. And bless their hearts, they functioned together and agreed on things and came up with that name for the health center that nobody has ever been able to spell. But they made a good board and they really cared, and that was the beginning. I would think that other people would say my greatest achievement as CEO is the founding and sustaining of a healthcare organization in an area where nobody wanted us to be. They did not want competition. Being in Elfrida, they didn't even know we were there and functioning until we were well established and had a stable patient base. So to be able to grow and prosper in an environment that is somewhat hostile to new people entering the marketplace really was significant. And you know, to this day, some of that still exists. The road hasn't always been easy. I remember coming to association meetings when Proposition 204 was proposed. And actually, Andy Rindy and Bob Gomez came down to one of our board meetings and talked about what Proposition 204 would do. It was a very good thing for the majority of the people in the state of Arizona. It was devastating for Chiricahua community health centers because at that point we had just one clinic and we were in Elfrida. So people drove from all over Cochise County, which is the size of Rhode Island and Connecticut combined, but we were the only sliding fee scale and the only subsidized health care available, so they came. After Proposition 204, they didn't have to do that. Our numbers went down dramatically. We didn't do any layoffs. We all took significant salary cuts. We cleaned our own clinic. We didn't have bottled water. We did everything we knew how to do to cut costs. And then we went out on a limb. It occurred to us that the insured population was, or the access insured population, now covered under Proposition 204, were in Douglas. So we took a chance and we opened a clinic, a small clinic in Douglas, and it saved us. So the rest is history. I think it's always good to go slowly and think about what you're doing in the ecumenical view, because often actions you take in one place have very broad ramifications across a county, across a state, across a community. So if I had advice, it would be to go slow and thoughtfully and listen to the patients that you're serving. The first thing I plan to do is walk the Camino de Santiago, which is a 1,000-year-old pilgrimage. It's in the Pyrenees between France and Spain. Most of you know I have a very deep meditation practice, and that's been on my bucket list for a very long time. In addition to that, I'm going to attend a 3-month culinary institute in Italy. I'm a cook's cook, but I have no credentials, and besides, it sounds like a lot of fun. So those are my plans at this point, and I'm going to go back to traveling, and I don't think I'll care where I wake up in the morning. I truly want to thank all of you for your friendship and your mentoring way back when, and your wisdom. And I'd like to quote Lori Jers one more time. She said at the end of one of her Christmas letters, "On a good day, this is the best job in the world." And it truly is. Thank you.